And we're live again. And welcome to another episode of Dojo Live, broadcasting as usual from the beautiful Mexico City offices of Nearsoft. And today I want to welcome Dr. Richard Munassi. He's the Chief Operating Officer at Doc Response, healthcare technology startup. And of course, Dr. Munassi has a man of who's definitely uh, a man of who wears a lot of hats based on the conversations that I have had with him. And his expertise includes strategic project management, strategy development, organizational startup, program expansion, executive leadership, resource utilization, and relationship building experience. He has a proven track record of creating transformational strategies. You're going to talk to me about that, Dr. Munassi, because
Definitely.
it's something that pulls definitely my attention. To implement change in collaboration with physicians, colleagues, donors, and business partners. But I think that Dr. Munassi would be definitely best suited to talk about his chosen topic and elaborate on his background, of course. So without further ado, I'm not going to hold the mic anymore, so I'm going to pass on the mic to Dr. Munassi. And today he's going to be talking to us about in basically innovation in health IT. Dr. Munassi, welcome to the show.
Thank you, Carlos. I appreciate you for having me today. And thank you for everyone who's joining us from all over the world. Thank you for taking the time out to listen to me and Carlos today, discuss healthcare IT and innovations in healthcare.
We appreciate it so much, and thank you for having agreed to be here with us today. Okay, let's start for obvious reasons. Let's start with the chosen topic of today, which is innovations in healthcare IT. I've done my share of research on the topic, and although I'm not, as I mentioned to you, Dr. Munassi, I'm not an engineer, but from the user end, of course, there might be a couple of things or two that I'm definitely intrigued about. And one of them, of course, is there's something that I really became intrigued about is this tendency that we as users have when it comes to experiencing some kind of illness. We go to the internet, we go online, we look for a solution or a remedy or what have you, just to feel better, right? But I don't, based on what I know, what I've seen, I don't think that would be like the way to go. That would be something could be wrong. Would you care to elaborate on this a little bit? And let's start by that, Dr. Munassi, and then
Sure.
Please, we're listening. So thank you again.
No problem. Well, thank you again. And as far as the whole issue of people going online and kind of looking up their symptoms and looking up other issues and maladies that they may have and try to self-diagnose and self-treat, this is a big problem today. With regards to healthcare information on the internet, anyone can go anywhere, anyone can post anything, and this is becoming a big problem with regards to both the patient and also the physician as well. Patients are going online at rates that are growing higher every day. They have access to the internet via their computer, via their cell phone, via tablet, and they're using their time on the internet to really look up things and trying to understand very complex healthcare issues without a healthcare background. And there's nothing wrong with wanting to learn and get more information. However, it's kind of like a double-edged sword. On one hand, there's some amazing stuff out there. If you look at the Journal of America, the American Medical Association, the British Medical Journal, the Lancet, I mean, there's some incredibly valuable resources, but they're coupled with a lot of junk science. And that's really, one of the biggest issues I feel that is out there right now in the current healthcare environment. How are patients going to be able to find places that have accurate healthcare information? Who's vetting these places? If you go on WebMD, as I'm sure you have, and even I have, and many millions of people do every year, you can kind of play around with your issues, and the results that you're going to get are going to be incredibly inaccurate. And people all the time, they come up to me and they say, they look at our company and what our solution provides, and it's a very accurate assessment tool. and they look at other companies like WebMD and even unfortunately the Mayo Clinic, and they get back these wild results of information, and then they'll ask me and they'll say, well, what makes your software, better than them or different? And I try to tell them that, my company, Doc Response, we're a company that's completely built by specialist physicians, and we've come together to really solve this critical issue, and that's accurate medical information. So what we do is we have a team of about 30 clinicians right now. Our software platform covers over 350 diagnoses. It's an assessment tool that is available through your provider, through your wellness portal, or through your physician at the point of care. And you run through an algorithm-based assessment tool, and it generates a differential diagnosis list to give both you as a patient as well as your physician accurate medical information that's put together by board-certified specialist physician teams. Now, stepping away from our tool and just talking about, in general, the issue at hand as far as inaccurate medical information being available to patients, I mean, this is an issue that every physician across the country in the US and even overseas that they see every single day. Their patients walking into their clinics with stacks of papers they printed out on the internet that say God knows what and to do, whatever from God knows who. And unfortunately, what these patients aren't realizing is that there are serious repercussions from some of the things that they're going to find online. There are things such as something as simple as grapefruit juice. If you drink a glass of grapefruit juice, it can greatly affect the potency of the pharmaceuticals that you take. So if you're on a blood pressure medication of some kind, or even, a mental health, antidepressant drug, your body can react very, very differently to that said medication, even drinking something as simple as a glass of grapefruit juice, let alone these supplements and crazy herbs that many people are unfortunately willing to take based on something they read online.
And in this, thank you, Dr. Munassi. And one of the things that I just popped into my head as I was listening to you is, I think there is a, let's say, there is a hardwired component when it comes to the general public, the users at large, trying to find an immediate solution for what they're experiencing. So I believe also there's and this is based also on things that have happened to me. There's like a strong component, an emotional component, because let's say that you have, I don't know, your kid might be ill, seriously ill, and then the first thing that we need to, what we want is we find something quick, right now, like this. And so the internet provides just that access, immediate access to a whole bunch of information. So, but as you say, there's a lot of things out there, a lot of info there that's really uploaded or provided, but not so reliable resources or sources, better said. So I think that how would you overcome? Let's say that I learn about Doc Response and then I go to your website, but I'm very hardwired. And how do you overcome your users' reluctance to try other venues and get acquainted with better or more reliable venues to find a solution? How would you suggest, or what would you do to overcome that?
Well, that's a great question. And all I can really say is this is, there's a lot out there. I'm sure your users, just like myself and yourself, have used places like iTriage, like WebMD, like the Mayo Clinic, and they've found incredibly inaccurate information. And all I can tell you is that, our solution, it was found to be the most accurate across 4 countries in a study that was published in the July British Medical Journal, in a study that was actually done by Harvard Medical School that looked at these software platforms from 4 different countries: the United States, the UK, Poland, and the Netherlands. They took a look at initially over 140 different software tools that are similar to our software platform. They ran them through a series of clinical tests, and at the end, we came out number 1 overall with regards to accuracy. So, you don't have to trust me. You don't have to take a leap of faith. You can look at, the British Medical Journal, which is one of the most established and respected medical journals in the world, for the validation.
Mm-hmm. Okay, excellent. Thank you, doctor.
You're welcome.
Another thing is, actually, you mentioned that, well, I'm sorry. your the information on your website mentions that if you're like a third of adults in the U.S., you head to the internet and do the things that we discussed. So, what about the rest of the world? As the internet gets more accessible to people all over the world, what's going to happen to these people who are um, prone, let's put it that way, to just do what grandma says, right? Or to try home remedies, or once they get access to the web, going to Google in the rest of the world. So, how can
Well,
that be solved?
Well, the thing is, that first of all, the 100 million number, honestly, I believe that it's incredibly low. I can ask anybody that I know, hey, have you ever gone online and looked something up? Have you ever
Hmm.
used, a company like WebMD or Mayo Clinic or iTriage? And I guarantee you, every single person that I'll speak to will say yes. There's a growing tech savviness that's kind of going throughout the United States population.
Hmm.
The 100 million mark, as far as annual users of assessment tools, I mean, I think that that's woefully short. And I think that's only going to continue to grow incredibly bigger, both in the U.S. and across the world, as internet is being provided at a faster rate and at faster speeds
Hmm.
in areas from the United States to even the third world. I actually spent a year when I finished my undergraduate studies at UC San Diego. I
Hmm.
spent a year in India doing volunteering and traveling throughout the region and working with different hospitals. And this was in, oh my gosh, I'm going to date myself here, in 2004 when I finished my undergrad studies.
Hmm.
And when I was out there, there was really like no internet. The only internet you could really get access to was AOL Instant Messenger. And even then, that maybe worked half the time. The speeds were so low. And now you turn around and you look, and there's high speed internet everywhere throughout India and throughout those regions. So, as people, as far as shifting their ideals and their habits, I think that it's only a matter of time. And I think it's already happening. And unfortunately, there has to be kind of a centralized repository for accurate medical information. There's been attempts made. I know that the NHS out in United Kingdom, they've put together their software platform that's available to their patient population. However, for whatever reason, even the UK government has not been able to gather the accuracy that our company has been able to do. So we greatly outperformed them as well in the British Medical Journal article. And I think that it really takes hard work and dedication, focused clinical staff, and the secret sauce that we have in order to get together and pull together something that's available to the patient population and that can help them in the proper way.
Hmm. Okay. Thank you. And secret sauce. I like that.
Thank you.
It's kind,
Can't share all the information,
of course, of course, there are some things that just remain secret, just like KFC's secret formula for chicken.
Exactly.
So exactly. So, but speaking about your secret sauce, I believe that your sauce is capable of integrating to via API into any existing software platform, right?
That's correct. We have a REST API with a little bit of tweaks. It can get into any software platform. We're very, very proud of it. A lot of people don't realize that it was a very difficult undertaking. It took us about 3 years to really get the platform where it is today
Hmm.
and to get it where it's ready for full deployment.
Hmm.
We spent a lot of time working with our physician teams, with our physician extenders, testing it out in live clinical setting with live patients. I mean, it was quite the process and quite the undertaking. And when we started this company, we really wanted to do one thing, and that's provide patients with better information so
Hmm.
that they're not going out there and making poor decisions. And now, as the healthcare environment in the United States is shifting to value-based care, a tool like ours is ever more valuable than it
Hmm.
was in the past. Everything is going from a fee-for-service kind of background to more of a quality-based background. The
Hmm.
government's doing a very hard push for it here in the States. And as a result, organizations everywhere from self-insured employers all the way through to large healthcare organizations like Kaiser Permanente, they're looking for ways to engage their patients, to increase the quality of care, to ensure that their physicians are doing the very best they can for their patient population, and to decrease the number of specialist referrals. So at the end of the day, it's tools like our tool and other tools that are available on the market that are going to help organizations reach their quality goals and hit those quality metrics going from now and into the future.
Okay, thank you again. And I'm trying to here's another thing. I'm trying to link what you're mentioning
Sure.
to your how can I say this? Please let me word my thoughts. Sometimes I'm a little bit slow.
No
So,
problem.
okay, talking about the current healthcare issues, for example, aging population. Let's talk about that. I think it's an interesting view on things because, especially with the aging population, we're talking about people who are not very prone to using technology. Okay, so how do you tackle that particular segment of the population when it comes to the fact that it's an online, that it's a web-based platform, in order to accommodate the needs of these particular segment of the population?
Yeah, that's a great question. And it's the $1 million question. It's a question that every organization throughout the United States is really asking themselves. How do we get this segment of the healthcare population to utilize the software tools that are available to make better choices? And the answer is a very complicated one. But it's one that really starts with the organization themselves. Will the organization provide platforms like ours and other great tools that are out there?
Hmm.
Will they make it available to the patient population where they can use it on their healthcare wellness portal, be able to use it on their cell phone, on their computer? Once it's in front of people, we feel and we have seen actually that even with the older population, they'll use it. I mean, it's very surprising because you think about, my father's in almost 70 years old. He still types. When he types on his keyboard, he types with one finger at a time. However, he does use software platforms like ours, and he uses them to get more information. So even though it is a hard market to kind of penetrate, if you really think about it, and you kind of take a look at things, it's things that are being done every day from this patient population. It's
Hmm.
software that they're very comfortable with. And the question is just being able to make them aware of it and give them the access to it. Now, another thing I want to touch on as
Sure.
well with regards to these healthcare issues, there's an incredibly large number of people aging into 65 years of age here in the US every single day. 12,000 people a day are aging into retirement in the United States. So with entering into the 65-year kind of window, it changes, how your healthcare is provided to you, because you shift from private insurance, work-based insurance, to government-based insurance with Medicaid. So that is why it's really of critical importance to get in front of the problem, because you have that patient population that's putting a huge tax on the U.S. economic system. You have the new patients that are coming in from the PPACA Act and other requirements that are requiring people to have healthcare insurance today. You have those things really taxing a system that already has an issue with regards to physician shortage. Their doctors, oh my gosh, the other day I was reading that it's like a 60-day wait for a visit in Boston and in New York and
Hmm.
these other cities. Like if you have an issue, and you want to set an appointment, you're going to be waiting for weeks. And that's
Hmm.
really unacceptable. And speaking of those issues, there is a change that's currently happening in the US, and that's the push towards telemedicine. This is going to kind of combine the whole technology aspect of healthcare with the kind of ease of access
Hmm.
and the just physicians being able to see patients more quickly and helping kind of ease that burden. And you're seeing it happen in places like California with Kaiser Permanente, where the
Hmm.
CEO recently came out and he stated that last year there were more email and telemedicine visits for Kaiser Permanente than regular visits. So we're talking about visits in like well over 1 million that are done on a cell phone between a provider and their patient. So, I mean, there's some big changes coming to healthcare IT, and it's starting right now. And there's some great opportunity for companies that are identifying problems and looking to solve these pain points.
Okay. Telemedicine. And speaking of which, that kind of leads me to Well, let me put it this way. I'm gonna ask you a question because there's something in information that I have about you and your company that I really don't understand that much, and probably there's some folks out there might not either. And so, if you could elaborate a little bit of what you mean by real-time sentry systems to combat.
That's actually with regards to a colleague of mine. I was gonna. So I know we had spoken about that a little bit earlier, and with regards to that, I was just wanted to bring up a couple of great software tools that I've seen out there
Uh-huh.
with regards to that will really change how healthcare is going. So there's a company called Cognetics that's out of Houston, Texas,
Uh-huh.
and they have essentially a real-time sentry system for healthcare data breaches. And I don't know if you've been following the news in the States with regards to healthcare data breaches, but there's been some crazy stuff happening. There's been some ransomware issues that have been happening out of Los Angeles and in other small towns where malicious software is coming in. It's
Hmm.
kind of locking up the healthcare systems, and the hackers are refusing to open things up without being paid in Bitcoin.
Hmm.
And these are things that people aren't really talking about. But I mean, user data at the patient level, you have social security numbers, you have addresses, you have these things that would make it very, very simple for identity theft to occur. And there's not really a lot of things that are happening to stop that. Like right now, the way the system is set up, you'll have a breach, and then you won't find out about the breach. It won't be reported until sometimes weeks later when the companies go back and take a look and do audits. So there's some pretty amazing things coming out of health IT. Cognetics is the company that I'm talking about. Oh, let me see if I can remember how they spell it. I believe it's Cognetyx. And they have established something that's pretty crazy with regards to basically whenever a user touches the interface in a healthcare system, they have like a digital fingerprint. So the way that they react, what they access, things of that nature. Cognetics essentially uses um, cloud-based technology to recognize those patterns. And once those patterns are being deviated, it alerts the health IT manager and it allows them to stop data breaches in minutes. It's some pretty crazy software that's happening out there. So, wanted to bring it up just with regards to talking about the future of healthcare IT. I think we're going to see more things like that, more real-time treatment, more real-time data protection, just more real-time, honestly, everything.
Hmm.
Because, healthcare, unfortunately, is of all of the fields out there, I believe it's the slowest with regards to adapting to technological change. We saw it with the shift to EHR. How many physicians, oh my goodness, I mean, I can't tell you how many just fought the fact that they didn't want to deal with laptops or computers. They
Hmm.
wanted to stay in the whole, the old system of writing things down in a chart. And, whether they were unaware or ambivalent to the fact that that resulted in poorer patient outcomes, I don't know. But the government kind of had to push to it, and it took a long time to do even something as simple as that. When, it's not even a cost issue because there's a great free EHR out there called Practice Fusion that has, I believe, like close to 1 million physician users right now. So I mean, it's just unfortunately, healthcare is one of those things where, in order to implement a new technology, even given all of the proof that you can have and all the data you can have, it still takes quite a long time.
Hmm. Time is I think it's of the essence, especially in real time and scenarios, and especially and more especially, I think that when it comes to the clinical decision making. Uh, in that regard, what do you think about, or what's your view on um, the present or the future, the immediate future for time sensitive clinical decision support tools, for example?
I think we're at an age where we have the technology to do it. We have the technology for physicians to be made available where they can make better choices, where their limits are not just kind of walled off by their education line. The average primary care physician, for example, they'll go to medical school, then they'll do residency for 3 to 4 years, and they're kind of limited in their scope of knowledge. And we're kind of we're at the point now technologically where that physician can have access to tools that will be able to have them make a better decision than they could have on their own. And that's another reason why we kind of created what we did. We gathered board certified specialist physicians from multiple different specialists to build out our algorithm sets to assist primary care physicians at the point of care. So where a primary care physician would see a patient and they weren't sure kind of which way to go or what information that they could gather, our tool really helps them gather more data in a less amount of time and to make a better decision that will result in better patient outcomes. But it's not just us in general. I mean, you're looking at, especially with telemedicine, I mean, there's going to be some big changes on the horizon. Let's think about it from, let's say, an emergency room perspective. So if you're sitting at home and if you injure your arm, and right now the protocol is, you'll call 911, an ambulance will come out, they'll try to stabilize your break, and they'll try to take you into the office. To the ER as fast as possible for a physician to take a look at it. When you get to the ER, you'll be put into triage, then you'll be sent up to X-ray, and you have to wait for the films and the results. Then the doctor will have to take a look at you, and then you'd have to be, have an orthopedist possibly come in and then schedule you for surgery. I mean, it's this massively long process for something that can be done a lot quicker. So what I anticipate seeing in the future, and what's really even starting to happen now, is you're going to see technologies enter into like an ambulance setting, for an example. Where the physician will be able to essentially sit in the rig via a tablet or some other sort of cloud-based tool, and be able to speak with the patient, be able to even possibly assess them remotely, and really get the ball moving a lot quicker with regards to treatment. And when it comes to things like strokes and heart attacks, those seconds equal lives being able to be saved, better outcomes for the long term, and much more. So that's just one thing that I think of many that are coming with regards to healthcare in the next 5 to 10 years. Being a part of the Texas Medical Center Accelerator program that we just wrapped up called TMCX, I was privy along with my cohort to see some amazing technologies, things that are just kind of mind-boggling with regards to not only the potential, but also the simplicity of dealing with certain pain points that are really problem areas for physicians and for the patient population.
Okay, thank you, Dr. Munassi. How do you engage your patients?
Oh man, that's a great question. I think that's something that needs to be done with the help of sales and marketing. I hate to say it, but it's true. You need to be able to utilize marketing's information gathering capabilities to really see what patients need, and be able to provide and even build out things that you might not have in order to solve those issues for the patients, and to give them the tools for them to make better healthcare choices. So, coming back to our platform, one of the things that we saw in our testing, in user testing, we had about 250,000 people or so, check us out, and we've had about 10,000 randomized user surveys. And one of the things that really jumped out at us was how many people were using our software and ended up saving a trip to the ER or the physician's office. 45% of the 10,000 people that responded to us stated that using our platform saved them an unnecessary trip to the ER, to the physician's office. So when this is translated, into not just an insurance company saving money or a self-insured employer saving those the work days where the patient would have taken off, but really the patient themselves and their quality of life, I mean, that's a massive savings. So with regards to getting things like our product and these other amazing products that are going to be entering the market or that are on the market now, with regards to getting it out there and getting those patients engaged, it really is kind of a whole cohesive thing where you work with sales, you work with marketing, you really push it out there to the patients, you let them know what's available, and you listen to their feedback, and then you adjust, just like any other company in any other field would adjust. You adjust to your clients and you give them what they want. And at the end of the day, everybody wants better health, from the patient level all the way up to the physician level and the executive level.
Okay, excellent. Thank you again, Dr. Munassi. And I was going to ask you something, but it might not be significant. But for the purposes of the platform, especially the marketing of the platform, is it better to think of the potential users of this platform as users or as patients, or where's the fine line that differentiates one and the other?
I don't think there is a fine line that differentiates them. I think that when you are talking about healthcare technology, that there's not really a differentiator there. You need to think about it as you're thinking about a patient. Think about what a patient needs, what they go through when they're sick, what they go through with regards to even their children being sick, the worry that they go through, the stress, trying to decide, how best to go about getting treatment, how they're going to pay for treatment. I mean, these are all things that I think really need to be taken into account with healthcare IT. It's not a simple cut and dry thing. It's
Hmm.
not like Uber, where Uber was, well, people want a better taxi, let's build a better taxi.
Hmm.
It's not like Google, where people want to find things in a better way. Of course, Google in its initial iteration. But with healthcare, it's this huge mix of multiple different issues that need to be addressed from from the fiscal side to the health side to I mean it's a crazy market.
Hmm.
It's tough to solve these problems, but thankfully there's some great people out there at everywhere from even Google itself to you know Silicon Beach, Silicon Valley, Houston, the Texas Medical Center. I mean, you have these hubs of innovation that are starting to pop up where people that would initially have gone into, tech at Silicon Valley are looking more into solving the problems for healthcare and helping the patient population as a whole.
Okay, absolutely. Thank you, doctor. Um, as far as the what do you think is the next in the healthcare space? What's next in the healthcare space? I mean, looking towards the next 5, 10, 15, 20 years.
I think we're really looking at a huge shift in healthcare. It's already kind of started. So, the old way is kind of you come in, you're seen for whatever issue is kind of popping up in your life at the moment, and the physicians and the hospital staff are getting paid from that, and then they're fixing you and you're moving on. I think we're really going to see a shift now to more of a population health dynamic where people are kind of taking control of their own health, where organizations are pushing for people to take control of their own health, and where people are making better decisions as a whole. I think the idea of you get sick and then you see your doctor, I think that's kind of going out the door.
Hmm.
And it's going to be replaced by people having, more of a control and more of, the desire to just stay healthy. And
Hmm.
whether that's, eating healthier, whether it's exercising, whether it's, getting more information about their specific diseases, it's all coming, and I think it's already starting. And the best part of it is if you reach in your pocket and you pull out your little phone here,
Yeah,
you
of
have a
course.
computer here that's more powerful. It's more powerful than computers from even when I was in third. You got a nice one.
No, I'm
It's
just going to show off my logo.
there you go.
Sorry.
No worries. You have a computer in your pocket that's more powerful than many desktop computers were a decade ago.
Hmm. Of course.
You have access to the internet. You have access to incredible, wealths of information. You have access to your own, patient portal through your insurance carrier or through your, through your work or through anything like that. You have this great tool in your hand. So I think the future of healthcare is really going to be medicine happening in your pocket at the touch of a button. You're going to see these physician interactions happening with telemedicine increases.
Hmm.
You're going to see, e-prescribing is already happening. You're just going to show up at Walmart. You can scan a QR code, get your medication. You're going to be able to, no matter where you are in the world, you'll be able to speak with a provider. I mean, it just the list goes on and on. And I think that your phone is really going to end up being essentially a medical device with regards to information, and even we're starting to see with regards to being able to track things. So there are devices that will be able to be plugged into your phone that will gather data that will help you make better healthcare choices. I think the first iteration is what we're seeing with wearables with regards to Fitbit and different companies of that manner, but it's only going to continue to get better and better and bigger. And I think that that is what we're really going to see in healthcare as the next step. And of course, even more than that, I think we're going to see the automation of medical assessments. IBM Watson is starting to kind of bust into the fray in Houston.
Hmm.
Essentially, it's a supercomputer that's gathering all the information that's provided by healthcare journals throughout the world and using it to help make better diagnostic decisions. Now, even though essentially that kind of creeps into our space, I have a lot of respect for IBM and what they're doing. However, I feel like there still needs to be kind of a human touch with regards to healthcare. So I think that it won't be 100% automated medical assessment, but I think that there's going to be a healthy mix. And I like to think that DocResponse is the first step towards that.
Hmm. Yeah, it certainly sounds like it is going to be definitely the first step, um, of many, of course. And I'd like to ask you something in particular about. I mean, I'm going to shift this conversation in a slightly different direction. I'm very interested in what you have been doing with TMC. So,
Sure.
can you tell us a little bit about, it, please?
Sure. Texas Medical Center is the largest medical center in the world. They're essentially a city within the city of Houston
Hmm.
that's nothing but hospitals and healthcare facilities and medical schools, and the list goes on and on. And what we did is we were invited out by Texas Medical Center to be a part of their accelerator program, which helped our company kind of expand and really flesh out some internal issues. Nothing bad, of course, but just growth and
Hmm.
accelerate the growth of our company.
Okay.
So we are technically a startup, even though we've been around for a little while. Even though our staff is physicians and we have a very very good team. Texas Medical Center Accelerator invited us in. We're part of 12 companies as part of their health IT cohort that started in January and that finished up last week. So being a part of that program, we really got to be able to interact with a lot of the leaders in the Texas Medical Center system. Everyone from MD Anderson Cancer Center to Memorial Hermann Healthcare to St. Luke's, CHI. I mean, the list goes on and on. There are some major, major players with regards to healthcare that are a part of the Texas Medical Center itself.
Hmm.
And they really wanted to put together a program to help innovative young companies like ours better ourselves and better the health of the Texas patient population.
Okay. Thank you so much, Dr. Munassi.
No problem.
Um, we're heading towards the final segment of the broadcast, and needless to say, I have this particular interest in asking you specifically about, as an entrepreneur, what kind of is there any major uh, failures or successes or challenges that you have had that you would be worth considering, sharing with the audience, maybe, so that we can all learn.
Sure. Well, we can talk about failures for quite a bit because the road to being an entrepreneur, it's not easy. A lot of people want to jump into areas like technology or really anything, and they expect to get quick returns
Mhm.
on their products or on their technologies. And the truth is, it's not easy. You have to spend a lot of time. I work 7 days a week with Doc Response. There's times I wake up in the morning, I check my phone, I'm answering emails, any customer support issues, all the way till when I go to bed, and that's just part of it. And it's the good and the bad of being an entrepreneur. The good of it is you set your own hours, you can make critical decisions without strong oversight. You can make the choices that you feel will be best for your company, but at the same time, it's a lot of sacrifice and it's a lots of hard work. One key thing that I would really recommend to anyone looking to start a software company in particular is really have a good team. Know who you're getting into bed with, because the people that you're going to work with, I mean, you're going to be working alongside of them for years.
Hmm.
And if you have equity, maybe longer than that.
Hmm.
That it might be your partner, even if they're not present. I've heard some terrible stories where people had, a 1 year cliff, 4 year vesting equity, and the day that that equity was vested, the worker would just say, "Well, that's it for me. My equity's fully vested. You guys are on your own," and they just not show up. And there's
Hmm.
nothing you can kind of do about that. You can try to fight it with a clawback, but it's not going to hold up in court. But my point is this: is you can build something amazing. You can work hard and you can change the world, but you have to do it the right way. You have to gather the right people around you that are dedicated and hardworking and that share your vision. And together, working in collaboration, amazing things can happen.
Hmm.
So that's my biggest thing that I would love to share with everyone watching today.
Hmm.
It's out there. There's amazing opportunities out there. Go get them, but do it the right way, and you'll be rewarded for life.
I totally hear you when you say that's um, a great team is definitely a must for any successful endeavor. And I think sometimes it's not that easy to assemble the right team because there might be a whole bunch of nuances and colors and when putting it together. So at least from in our experience here at Nearsoft, as we grow, there are many challenges, And that's, I guess, I assume that for any company, software company that is growing or that is just starting out, challenges are going to be similar, especially when you're talking about multicultural teams, just like which is our case. And it can be multicultural in one location, could be multicultural here and just in-house or distributed all over the world. So I guess that having a culturally aligned team and is kind of a challenging task. So
Oh, I
have you had
agree.
any experiences in assembling teams with culturally diverse backgrounds?
Absolutely. Our company is incredibly culturally diverse. I'm here from the States. Our CEO, he grew up in the Northeast, but his family's from Lebanon.
Hmm.
They were refugees. We have, my goodness, I mean, we have people from really all over. Some of our tech guys are from Russia,
Hmm.
as well as from, the Middle East. So being able to bring all of those people together is definitely a challenge, but it
Hmm.
really comes down to this. Will they share your vision? Are
Hmm.
they driving towards the same things you're driving towards with the
Hmm.
same reasoning? Do they want to go out there? Do they really want to help people if they're in health IT? Um, do they recognize the pain point? Do they really believe that they can solve the issue in the pain point? I mean, you're gonna come to little areas where you're gonna butt heads, where you're gonna hit speed blocks, and that's okay. But there's nothing wrong with that. But being able to keep your eyes on the prize and focus on the task at hand, that is what really differentiates a good team member and a good team from anything else.
Absolutely. Dr. Munassi, we're approaching the final minutes of these session. I'm sorry, I'm reaching out to something that I want to show you.
Sure.
Is we're going to be sending you by FedEx. So you at some point you're going to tell me where, but we're going to be sending you a small token of appreciation. Let me show it to you. And this is for any potential speakers out there that could be watching us. Just a small token of appreciation for being here with us today, which is one of these, and also one of these. Okay, so
Great. Thank
it's
you.
just kind of a. Let me show it to you on camera. I want to show it off.
Nice.
we kind of like them because it's metal and embroidered and so anyway, Dr. Munassi, I really want to thank you for having agreed to be here with us today. Would you like to leave our audience, whether current or future one, with some final words as what it takes to build a successful company, healthcare software, healthcare IT company? For anyone watching out there, what would you leave? What would you like to leave them with?
Sure. I'd like to leave you with this. There are a lot of problems in healthcare. There are problems from the very base levels of admissions through diagnostics to even at the executive level. There are lots of problems that are just waiting to be solved by you. So go out there, get embedded with the people, talk to patients, talk to administrators, talk to clerical staff, talk to physicians, talk to executives, talk to everybody you can.
Hmm.
Figure out what those pain points are, gather your team, and solve them. The power is in your hands. Literally, the touch of keystrokes and programming, you can put together amazing pieces of software that can really change the world. You have companies out in Silicon Valley that say that they're disrupting this or disrupting that and changing the world every day. You
Hmm.
have a chance out there in health IT to really change the world, to save lives, to save money on the billions. And it's all out there. So just go out there. You'll be able to help people. You'll be able to help yourself, and you can really disrupt healthcare. It's a wide open playing field, and they're hungry for innovation.
Thank you, Dr. Munassi. How do just one more final thing? How can your viewers reach out to you?
Sure, you can email me anytime. My email address is richard.manassi@docresponse.com,
Hmm.
RICHARD .MUN like Nancy, A like Apple,
Hmm.
S like Sam, S like Sam, I like India at docresponse.com. If you take a look over at our website, there's also a contact us form if you'd like to have more information. But please feel free. If you have any questions, I'd love to speak with anybody out there. I'd love to answer it as best as I can. And I'd love to talk to all of you out there to help you reach your goals too, and hopefully help the patient population, whether it's in the United States or abroad.
Perfect, perfect. We really appreciate so much. Please, would you mind checking if I typed in correctly? Richard.Munassi@response.com. Is this right?
That's absolutely perfect. Thank you so much, Carlos.
Absolutely, my pleasure, Dr. Munassi. Okay, well, folks, there you have it. We thank you again, Doctor, for having agreed to be here with us today. We really appreciate it, and we're going to be in touch. We need to send you these babies here.
I can't wait to see them. And thank you again, Carlos, for having me. And thank
Okay,
you to the entire NearSoft team. This was a great experience.
thank you. Likewise. Goodbye, Doctor. Have a great day.
You as well. Take care.
Bye bye.